Good morning. The video you're about to see was shot a few days ago, but I realized yesterday when I was doing the final edit on it that I'd missed a really important bit out, which was to say thank you. Thank you so much for following this channel. I've just passed 10,000 subscribers, which is a really, really big deal for me. So if you've ever liked or shared or commented on, I love the comments, on one of my videos, a huge, huge thank you. It's made a real difference to the last year and a half. As you're about to see, it's been a bit of a roller coaster year and a half for me personally, and YouTube has been a fantastic outlet both creatively and from a sort of support point of view actually. So here's the video. I hope you find some value in it. It does have a WordPress point to it, and I hope you enjoy it. Thanks for watching. This video will probably teach you many things. Probably the most important thing is how you can cram a WordPress metaphor into a health crisis. So I'm going to tell you a story, and then I'm going to tell you why I think this story is an important lesson for how we build websites for clients or how you build websites for yourself. So December 2021, I had a doctor's appointment because in the previous few months I'd been getting increasingly bad stomach pains. And over those few months I ruled out a few things. I didn't really want to go to the doctor, so I cut out eggs because I thought maybe it's an egg allergy. It seemed to coincide with eating eggs. That did nothing. The pains continued. I also cut out wheat because I thought maybe it's a wheat intolerance. That did nothing. The pains continued. Until finally I thought, well, maybe I'm doing it myself. I cycle a lot and I drink these water bottles, these plastic water bottles that are squeezy, and I thought, well, I'm drinking a lot of water, and maybe as part of that process I'm squeezing lots of air into my stomach. So by the time I walked into the doctor's surgery, I was fairly convinced I'd self-diagnosed myself as this water bottle was causing the stomach pains. And she kind of looked at me a bit quizzically and kind of agreed with me that that might be it, but let's keep an eye on it. But she said, while you're here, let's just have a quick look at you and just make sure there's nothing else causing it. And as part of that process, she put a thing on my finger and she measured my heart rate as well. And then she kind of turned to me and said, well, that's interesting. Your heart rate's going at 130. And I said, well, it's maybe because I'm a bit nervous, but 130 is really, really high. But then she also said, and it's also irregular. Now, at this point, I had absolutely no idea what that meant. But fundamentally, what it means is your heartbeat, and most people's heartbeat goes like this. Like a watch essentially, whereas my heartbeat was going, which the medical term for it is atrial fibrillation. Now I kind of doubted this at the time because I was wearing a cycling watch. So I said to her, look, it's only going 70, there must be something wrong. And I was kind of blustering my way through this, which looking back on it was massively embarrassing. So she said, okay, we'll come back next week and we'll put you in for an ECG, which is where they can measure it properly and give you a proper diagnosis of whether you've got a irregular heartbeat. So I was a little bit shaken up because I thought I was just going to walk out the doctor's surgery and go home and carry on my day. But this was clearly something of a different order of magnitude. So luckily I have a good cycling buddy of mine who's a heart surgeon, and I phoned him up and he talked me down and explained actually it's very common. It's called atrial fibrillation, and subsequently I learned that there's about 1 million people in the UK that have it. So it's really, really common. But there are some issues if you don't treat it. It can increase your risk of stroke and a few other bad things as well. So it wasn't a brilliant diagnosis. But anyway, I get back to the story. So I went back the following week and they strapped me up to these electrical things, and the nurse did the ECG, and then the doctor came and got me, and it was quite late in the day, and I said, I still remember it, I said, thank you so much for seeing me at such short notice. And I never forget the words he said, you're not going to thank me when I tell you what's wrong with you. So anyway, it turns out it was atrial fibrillation. My heart, turns out, was going about 130 the whole time, which is crazy fast, and it was irregular. A symptom of that was every day around 2 o'clock for quite a while I'd been completely exhausted, so I'd literally crash around 2 o'clock and often have to sleep. It's a running joke in my household that I would have to sleep around 2 o'clock. And actually there's certain members of my family that now understand why I was having to sleep during the day, because it was like I was running the whole time. I was running 130 beats per minute the whole time. You can imagine that. That's a fairly fast run. And so I'd get to 2 o'clock and be absolutely shattered. So that was the diagnosis. Again, I called my heart surgeon friend and he talked me down once again. Immediately following that doctor's appointment, I went out to the pharmacy and I got a whole bunch of meds, some beta blockers, essentially to slow down the heart rate, and also some blood thinners to reduce the risk of having a stroke, which is one of the potential side effects of having AF. So that's where the story started. I went in for a stomach complaint and it ended up with coming out with some sort of heart condition. So there's various treatments around heart conditions like AF, which I'll come on to. But about a week later, I guess, I had severe stomach pains once again. So it was quite late at night. They always seem to start quite late at night. And these were the worst I've ever had. Somebody who went through a similar sort of thing to me referred back to it as like having a spear stuck through your chest. So it was the worst pain I've ever encountered by far. And I ended up sort of lying on the floor and actually crying at some point because I was in so much pain. And we tried to call 111, but by the time we were having to give them my name and address, my wife said, come on, we're going down to A&E. So this is where the story starts to merge into metaphor. So we rushed down to A&E in my local hospital, and the first words they said to me were, you've come to the wrong hospital, which wasn't brilliant. But then I explained that I'd just been diagnosed with this heart condition, and then they kind of took it a bit more seriously, and they wheeled me in, and I had to wait in the ward. We're quite late at night at this point. It's about 11 o'clock at night. And what they said they were going to do is take me through to a CT scan. So a CT scanner, if you don't know what that is, it's a bit like an MRI scanner, I think, which is a big tunnel. It has magnets that whir around, and it basically scans you and gives them a proper view on what's going on inside. So this was during COVID, so my wife couldn't come in with me. She's gone home at this point. So I'm kind of all alone, and it's about 11 o'clock at night at this point, and it's my youngest daughter's birthday the following day. So there was lots of stuff going through my head. And so they wheeled me into the CT scanner, and I was in there for a really long time. They're pretty claustrophobic things. I was in there for a good 20 minutes, and they said I'd only be in there for about 10 minutes, I think. So it seemed to go on forever. They wheel me out, and in the next room, behind a glass panel, I can see a consultant and two nurses. And I look through the glass panel, and they're looking at the screen. They're looking at the results. And they're kind of, I swear they're shaking their heads like this. So at that point, the adrenaline in my body is just going crazy. And I'm just thinking, right, this is really serious. And I think they looked, I mean, I'm replaying this in my head, but they look kind of ashen-faced. And so I'm sitting there thinking, right, I'm checking out. This is probably something very, very serious, like they found a cancer that can't be operated on. I'm going to have to go home and tell my family goodbye. It's something really, really serious. So they come out of the room that's adjacent to the CT scanner, and I'm not a sort of quiet patient, so I immediately say to them, what have you found? And they're very nice, but they say, we can't say, we don't know. So it turns out that actually they don't have the expertise in the local hospital to diagnose something like that. Looking at the CT scan, they have to be sent away to South Africa, which is going to take a few hours. And I said, well, you saw something because you were looking at it. What did you see? And they were like, well, we're not sure. And now when somebody says they're not sure, that's probably the scariest thing you can ever hear. And I started to get a bit agitated at this point. I said, come on, you can tell me. What did you see? I said, no, really, we're not sure. So they wheel me back down to the ward. It's very late at night. So it's dark now. I'm lying there in the ward. But luckily, the pain in my stomach is subsiding at this point. They've given me some painkillers. So at least that's going away. But I'm lying there thinking, crikey, this is about as bad as it gets. So I wait lying down there for about 3 hours, I guess, something like that, until the nurse at some point pops her head around the curtains, and I'm expecting her to give me some really bad news. And she says, it's all fine. You're in the clear. What we saw on the CT scan were just some photographic aberrations, which I guess is some problem with the imagery. It's perfectly normal. You've been checked, so you can go home. So I sprang out of bed, and I think I ran out of the hospital, just incredibly relieved. And I got home, I don't know, about 2 o'clock in the morning. My wife came and picked me up, but I was actually met her halfway when she was driving to meet me because I was so elated to be alive and not dying. So at that point, we're okay. Have my daughter's birthday the next day and move on to Christmas. And subsequently, following that, I had my heart operation, my first heart operation, I think in February, and I had what's called a cardiac ablation. And what happens in that, and I'm going to put a video up on the screen in a minute of my actual video of my heart operation so you can see how it's working. But what they essentially do, they take a catheter, which is a wire, and they put it up through your groin, through your artery, I think, or vein, artery, I guess, and they come into the chamber up here. Now, I'm not medical at all, so I'm just repeating what I've sort of learned about this. From this chamber, and then the catheter goes into this chamber, but then it has to puncture through into this chamber, which hopefully you can see up on the video here. And And then in this chamber, they basically create like a 3D map using this catheter. It's like rocket science. It's incredible stuff. And then the cardiac surgeon uses this catheter to either freeze or burn off certain sections of the heart which are causing the erroneous electrical signals, because that's the problem. That's what's causing the problem. You have these erroneous electrical signals. Very common in cyclists, actually, that do a lot of miles, because sometimes your heart chambers up here apparently can increase in size, which can cause some issues with the electrical signals. They managed to do the operation fine. And actually, it's a very simple operation. You can be in and out in a day. And it all went fine. My heart went back into rhythm. And I went home. And that was all good. And we had booked a trip to Spain as a bit of R&R post the operation. And so we went to Spain with some friends to a place called Nerca on the south coast of Spain, where we were going to have some fun and drinks and tapas. But during that trip, on about day 2 of the 4-day trip, I started to get these stomach pains again. So the stomach pains were back, and they were actually worse than ever. So I was getting these stomach pains. Now in Spain, when we go to Spain, we tend to drink wine and we eat fried food, which I'll come on to why this was such a bad thing. So they were all drinking, having a really great time. This was my wife and 2 of our really good friends. And I was kind of sitting there drinking, well, I was drinking Lilt, which is a fizzy drink, which is a really bad thing to do, it turns out. Just feeling increasingly worse, to the point, again, where I had another night of agony, just complete agony. You can feel the pain coming on, and then you just know you're in for about sort of 6 to 8 hours of just complete agony. And at this point, you're kind of, it's not nice. You're throwing up and all sorts of bad stuff is going on. Anyway, the pain eased enough for us to fly home. And as we're in the airport, I didn't know this at the time, but they saw that my eyes had turned yellow. Now, having yellow eyes isn't necessarily a really good thing. It's obviously some issues with having yellow eyes. But as we were driving home to where we live, I was driving and I looked in the rear view mirror and I could see my eyes were yellow. So that kind of really spun me out. I had yellow eyes and nobody had mentioned anything. And then my wife said, yeah, we saw them at the airport. We didn't want to freak you out. So now I'm thinking yellow eyes, that's probably liver cancer or something terrible like that. Again, I'm checking out. But my friend, a good friend of mine, had gone through a similar sort of episodic pain that I'd been going through. And so I called him the next day, I think it was, or on the way back, and just talked through some of his symptoms. And it turns out his symptoms were gallstones. So the gallstones, I'm not going to go into all the details, but essentially the gallstones can get blocked as they're going through the gallbladder, or you can have gallstones that get blocked. And that can cause some sort of liver malfunction, which means you can have things like massive pain, and you can also have yellow eyes is another symptom of it. So that evening, I went over to another medical friend of mine. Thank you, Charlie. He's a cancer specialist. And he said it probably sounds like it probably could be gallstones, which would be the best prognosis. So I arranged to go and see an expert in that field. And we're coming on to the WordPress metaphor anytime now. And so I had an appointment with him to discuss my symptoms and what it could be and potential treatments. And before I really said anything, he said, well, I've seen your CT scan from December and there's a gallstone on it. So the CT scan that I had back in hospital, where they were checking for heart things, they'd actually missed the fact that I had a gallstone that was causing an issue. And he said, yeah, there's a gallstone. It's probably passed now, but because you've had one, you're likely to have more. So my recommendation is that you have your gallbladder out, which I did. So I had my gallbladder out a few weeks later, and that completely solved the stomach problems. That was the problem all along. Subsequently to that, and I will get to the metaphor, my heart actually went out of rhythm again, which is very common when you have an ablation. If you've had atrial fibrillation for quite a long time, sometimes it can take 2 goes at the operation. So I went back in September and had the second ablation operation. And we're now in March. Where are we now? March 2023. And for the last few months, my heart's been in good rhythm and going at a nice pace. So touch wood. I have some wood. Touch wood. That's all solved. My gallbladder is solved. So in the space of a year, I had 2 heart operations and I had 1 gallbladder operation. So it's been quite the year. But now for the cramming in the WordPress metaphor, I think it's interesting that, and I see this a lot in WordPress development, and I experience it with the hospital, and you do experience it in when you're going through medical stuff as well, actually, that when you're looking for a solution, the danger is often that you'll look at the one specific thing without looking at the holistic problem. For example, when I had my CT scan, they were looking at the heart. But actually, if they'd looked just not very far, they would have seen that I had a gallstone, which was causing the stomach pains in the first place, which is what I went in reporting. But they were kind of sidetracked by the heart thing. And it's kind of one of the biggest issues I see with a lot of the customers that come to me for help with WordPress, especially when they've had sites built for them. And actually, I was watching a video on YouTube yesterday about how to choose the best page builder. And it was all about the tool and the thing. There was no holistic view on, well, if you build it like this, is the customer going to be able to use it in 6 months' time, a year's time? What's the requirement for the customer? There was no looking at the whole organization or the whole person in the medical sense. And I think that's so important. It's probably, well, in my view, it should be the most important thing when you're either treating a patient or you're either building a website for a client. It's the client situation, whether they're building that site for themselves and they want to manage and update it after the event, or they're part of an organization that are going to have training requirements in 6 months, 12 months time, 18 months time. The tools you use and the approach you use has to consider that person first and foremost. So that's my story. All seems to have worked out fine. It's been an incredible adventure. I've met some amazing medical people. I want to thank my heart surgeon, Ashley Nesbitt, and I want to thank Tom Johnson for talking me down for the first diagnosis. I want to thank my gallbladder surgeon, Simon Higgs, and I want to thank Charlie Candish, who guided me through what it could have been. And I also want to thank Craig Baker for taking a call when most people wouldn't have taken the call. And so that's my story. It's been a really interesting story to live through, and I hope you find some of that interesting. And I hope you are not going through this yourselves. If you do have atrial fibrillation, don't panic. It's treatable and you can live with it. But if you do want a name of a great heart surgeon, get in touch in the comments below. Thanks for watching, and I'll see you soon.